Welcome to a new episode of Medicine in 3 Minutes. As usual, we go straight to the point. The subject is briefly made clear and often illustrated. Let's start. Today's topic is craniopharyngioma. What is craniopharyngioma? It's a rare type of brain tumor derived from pituitary gland, embryonic tissue that occur most commonly in children, but also affect adults. It might present at any age, even in the prenatal or neonatal period, but peak incidence rates are childhood onset at 5 to 14 and adult onset at 15 to 74. Here's a brief reminder to comprehend the mechanism of the formation of tumor. There are two glands involved in the mechanism of this tumor, the hypothalamus and the anterior pituitary. The hypothalamus sends stimulus to the anterior pituitary, and anterior pituitary sends stimulus to FSH/LH, ACTH, TSH, prolactin, and growth hormone. Craniopharyngioma is known as Rathke pouch tumor or Adamantinoma. It's a slow-growing brain tumor. It's a benign tumor, but she used to recur after surgery removal. Prevalence is 2 to 0.5 of all primary brain tumor. As we say, it's more common in children and elderly. Symptoms are fever, fatigue, stunted growth, increased urination, thirst, and if the tumor is large, it gives some vision complication. Diagnosis by biopsy and treatment is surgery plus adjuvant chemotherapy and radiotherapy. Craniopharyngioma is a slow-growing brain tumor known as Rathke pouch tumor or Adamantinoma, more common in children and elderly. Stunted growth tumor. Symptoms include increased urination and thirst. And if the tumor is large, there is vision problem. We can visualize supracellular calcification. After surgery, who is to blame for recurrence after surgical removal? Here is to refer you to our video about diabetes insipidus. As we said, if the tumor is large, there is a bitemporal hemianopsia by compression of the optic chiasma. In craniopharyngioma, there is an pituitary insufficiency, hypopituitarism. There is Addison disease and hypothyroidism, two distinguished endocrine diseases, hypothyroidism and Addison disease. Symptoms of Addison disease include asthenia, anorexia, hypotension, hypoglycemia, and hyperpigmentation. digestive disturbance, and depression. This is for Addison disease. For hypothyroidy, dry skin, goiter, sensitivity to cold, hair loss, irregular bleeding, bradycardia, constipation, diabetes insipidus, and no lactation. Treatment include surgery plus adjuvant chemotherapy and radiotherapy. Let's review what we said. Craniopharyngia is known as Rathke pouch tumor or Adamantinoma. It's slow-growing brain tumor. Benign but recur after surgery removal. It's 2.5 of all primary brain tumor, more common in children and elderly. Fever, fatigue, standard growth, increased urination, thirst, large tumor vision complication, diagnostic and by biopsy, and treatment include surgery, adjuvant chemotherapy, and radiotherapy. Don't forget diabetes insipidus. Don't forget bitemporal immunopsy by compression of chiasma. Remember, it's a slowing tumor, more common in children and elderly. Standard growth, thirst, increased urination, and if it's large, there is vision problem. There is some recurrence after surgery. Pituitary insufficiency, there is two syndromes. The first one is Addison, and the second one is hypothyroidy. Addison, remember, asthenia, anorexia, hyperpigmentation, hypoglycemia, the hypothyroidy, and hypotension, digestive disturbance, and depression. Hypothyroidy, dry skin, goiter, sensitivity to cold, hair loss, irregular bleeding, bradycardia, constipation, diabetes insipidus, and no lactation. Remember, it could be a sudden death. Thank you for watching this episode of Medicine in 3 Minutes. If you are new, please subscribe. Your comments are very welcome, and please click the like button. Thank you.